Cervical cancer is a major problem in India, which has 1/4 of the world's burden and 67,000 women dying of the disease, which is more than the number dying of maternal mortality. Efforts to make it a national screening program, whether based on PAP or whether based on VIA, have yet not succeeded. So we have to think about making some women more equal than others, as it were, and to give them the first option. So we looked at the HIV population coming to our clinic, and we found that these women had no knowledge of cervical cancer, of their increased risk, and had never come for a screening test. Moreover, when we screened them, we found that there were about 7% who had a high-grade CIN lesion or even invasive cancer. And this was about 3 to 4 times the number that we usually find when we go out into an unscreened population, and sometimes that rate may be even less than 0.5%, whereas in the HIV positive it was over 6 to 7%. So we feel that the best thing to do is to go out into all the HIV centers and tell them to compulsorily inform the women that they must come for a screening, because there's a very high chance that they are harboring an asymptomatic lesion, and this is where we can really make a difference when we intervene ahead of time. So we may not have an impact so much on incidence, but definitely a mortality impact, and give them a good quality of life. We also found that these women were extremely compliant with treatment, and we saw that it was irrespective of the heart, and that they, in spite of having good coverage with the treatment for HIV, were still subject to a higher prevalence of CIN. So in conclusion, we would recommend that this be made almost like a compulsory thing for all the centers to do who are involved in the treatment of women with HIV and AIDS.